weekly Facebook Live. We didn't get to do it last week because of some technical problems, but here we are this week in a new location in our office. Maybe what we'll do is shoot videos at different locations throughout the office, and we get a little bit of an office tour each week because one of our practice members had a great recommendation. She said that we have such a unique and beautiful office that we should give a tour, and maybe we'll do that as a one-off, not necessarily our Thursday Facebook Live. But what we can do is maybe shoot different locations throughout the office so you can get pictures of our office here and there. Again, it's Thursday, it's 1:30. My name's Dr. Ammitai Worob, chiropractor in Ithaca, New York, here at Change Family Chiropractic. And today's topic, like last week, but this week we're doing it, is do I really need x-rays? So this is a question we get a lot of times is, do I really need x-rays? What is it going to do? Is it going to be too much radiation? What does it cost? So I want to answer those questions today on our Facebook Live video. So, anytime we're looking at any clinical decision making, we're looking at, any doctor, the rule is first do no harm, right? So that brings up 2 points, which I'll address in a moment. The second thing it really is, any physician is going to work in the framework of coming to the right diagnosis for the patient. And if you get the right diagnosis, you will then be able to give an accurate or appropriate prognosis for the patient, and then render the appropriate treatment plan. So, if the diagnosis, and this is not necessarily in my office, giving you an example, if the diagnosis is you have a upper respiratory viral infection, that's the diagnosis. Prognosis is it's probably going to get better in the next couple of days, the next couple of weeks. And the treatment is rest, fluids, and if things don't get better in 3 weeks, then there may be a secondary infection or whatever. But, if you have the right, as opposed to if you have the wrong diagnosis, let's say you say it's a bacterial infection when it's a viral infection, then the treatment would be totally different. It could be, we think you have a bacterial infection, the prognosis is we should be able to wipe this out with antibiotics within a couple days. And the treatment is we give you a course of antibiotics. If the antibiotics don't, but if it's not the right diagnosis, the antibiotics aren't going to do what, knock out the virus, right? And therefore the prognosis is different and the treatment was the wrong treatment. So going back to the question of first do no harm, when it comes to imaging, there's different kinds of imaging. There's x-rays, there's MRIs, there's CT scans, there's ultrasound. And when it comes to x-rays, there is some radiation involved. X-rays been around for over 100 years, well over 100 years, and the exposure times to x-rays now compared to even 20 years ago are minuscule. And the amount of radiation you would get for a set of cervical spine films of your neck or of your low back or of your, of your mid back, you get less radiation exposure getting a set of one-time x-rays than you would picking your friend up at the airport when it comes to radiation exposure. So in terms of do no harm, what I can tell you is that x-rays, if you're not getting routine x-rays, I mean, this is not something you're doing every single day, you're getting one set of x-rays. In terms of the safety factor is safe. One set of cervical, one region of x-rays of your spine, you'd need to do that about 3,000 times to hit what the FDA is saying is the point at which it's not safe. So that means you'd have to be getting about 8 sets of x-rays a day, every day for a year before you hit that. So short story, safe. So again, first do no harm, box checked, safe. Second thing with first do no harm is, as a chiropractor, I use many different techniques in my office, and different chiropractors use different techniques, but anyone who's using an osseous technique, a technique where you're doing some kind of spinal adjustment or some might call it a manipulation, I want to know that I'm not doing harm there. If there is a tumor infection, if there is a congenital fusion, there's every year I maybe see a dozen or 15 people who have either single or multi-level fusion, or there's sometimes people who report that they have had no surgeries, and then I see there's hardware in their spine. So, you know, oh, I didn't think that mattered because it was 30 years ago, kind of thing. So being able to rule out contraindications for spinal adjusting, it fits into that first do no harm category. So, you know, in terms of are x-rays needed? You know, it's one of those things where it's like, do you need car insurance? Well, legally you do, and legally and ethically my job is to give an accurate, again, diagnosis and prognosis so that I can render the proper treatment. Now, in terms of like driving without car insurance, if you don't get any tickets, I guess, you know, you got away without having car insurance. And there's a lot of times where, you know, you can see a chiropractor and x-rays aren't taken and everything works out fine. But there are times where that doesn't happen. And that's why it's not, you know, it really is case dependent, but anyone who's had any kind of trauma, anyone who's over a certain age, which really, you know, when you get to past a certain age, and when I'm talking about a certain age, I'm talking about single digits, who has not had trauma, it's worth seeing what's going on so that we can, and this is not something that we do every day, every week, every month with the patient, but to get a clear picture of what's going on with the patient so that I not only know what to do and what not to do, but what might be appropriate for home care as well. In the end, it makes for a better diagnosis, an accurate prognosis, a better course of treatment, and better results. And there's a link that we'll post in the Facebook live chat where it's a peer-reviewed article talking about how outcomes are better when we have diagnostics. Now, is there such a thing as overutilization diagnostics? For sure. But I think that getting a one-time set of films to see what is going on with somebody's spine or follow-up as need be is wholly appropriate and actually in the best interest of the patient and their care and progress. So, you know, what I'm looking for on x-rays are a number of things. One, again, I want to be able to rule out anything pathological, which I would need to refer out for, or any contraindications, which would either tell me that what I do is not appropriate, or maybe it alters what I do. Like I said, I do a number of different techniques, some of which are non-force or low-force technique, where I'm not putting a thrust into the spine, where we're doing things slowly or holding or using gravity or using instruments, which are low-force techniques, and those are totally appropriate where a high-velocity thrust isn't, where adjusting by hand isn't. So I want to know that first I'm doing no harm, and not only that I'm not doing harm, but I've had folks where they've come in and we've found, you know, pathologies which we've referred to medical professionals, which in the end end up either adding years to life or saving lives because we saw something before it would have been seen otherwise. Like there's a gentleman who came in with prostate cancer that had metastasized. We saw that, and that added years to life for him. The second thing is I want to know that I want to know what level of degeneration there is, what areas of loss of normal curve there is, if there are any abnormalities, like congenital abnormalities, because that's going to be able to let me tell the patient, I expect that you'll get better in this much time. Or there's a lot of degeneration, there's disc herniations, there's whatever it is, spinal stenosis, I'd expect it might take this much time, or we'll get this much better, but at this point, I don't know that we can expect more than that. Again, giving an accurate prognosis. And then after we've arrived at that, then we can come up with a treatment plan, like someone I just saw earlier today. We're going to be working together for about a month here, and then I'm going to be referring her to physical therapy while continuing to see us here, but at a reduced frequency here, because we're going to need to move from more passive therapies that we're doing here into more active therapies. In this particular realm of physical therapy, I don't do in my office. So we're going to co-manage with the physical therapist. And it's all part of that treatment plan to get somebody better faster. And part of what we saw there was what we saw in imaging. So to answer the question, do I really need x-rays? Well, I think to have a appropriate level of care for many people, the answer is yes. It's not for everyone. It's not like I send everybody for x-rays. But when it comes to the cost-benefit ratio, it's wildly in favor of getting imaging. Because what are the costs? We talked about safety. It's a non-issue. Second is monetary cost, right? For most people who have a standard, insurance or even a high deductible insurance, their cost of getting x-rays is about anywhere from $0 to $120 in most cases. So it's not a huge monetary outlay either. And then to know that we're first doing no harm, that we're doing appropriate things for someone's care in the office to get them better as quickly as possible and keep them better. And to know who to refer to and when and how we can co-manage patients. A lot of times imaging is really helpful in that regard. So in terms of, do I really need x-rays? Probably if the practitioner that's recommended them is recommending them, the answer is yes. I just had a conversation earlier today about a particular therapy that someone had a question about. And they said, do I really need this? I said, if I didn't think you needed it, I wouldn't recommend it. That's part of my ethical obligation as a doctor, is to give the best recommendations possible for my patients. It's whether people choose to do that or not. I was talking with a physical therapist the other day. Not everyone chooses to do the exercises they're prescribed, but it's still the physical therapist's job to prescribe those exercises. So if you have thoughts on this, I would love to hear them, because this is a conversation that we have all the time here in the office. I have it interprofessionally with other chiropractors and other health providers. I would love to have this conversation with anyone who's interested, either online or here in the office. So please comment. If you haven't liked us on Facebook, please like us so that you'll get notifications when we're going live on Facebook. If you haven't subscribed to our YouTube channel, please do that, because if you missed us live on Facebook, you'll get a notification when we upload this up to YouTube. And if what we talked about what seemed relevant to you in some way, where you thought, well, gee, this guy might be able to help us out, or me out, or my wife out, or my husband out, or my children, there's going to be a link also here. We have an opportunity over the summer for people to come in at a reduced cost. So there's a link here that you'll be able to click on to get that opportunity. So check out the links. In terms of the link with the article about x-rays, it's kind of dry. I like it. You might geek out on it, but if you're not interested in that, rewatch this, ask questions. We'll put the answers up. And if you have questions beyond what would be appropriate on commenting on Facebook, set up an appointment. I'd love to chat with you and see if I can help you out. So next week, we will be live on Facebook, same time, 1:30 Thursday. I'll look forward to seeing you then.